Welcome to my clinic. This is the room basic unit for the hair regeneration treatment using the AAPE, and this consists of the measuring device and the treatment chair and the shampoo washing unit. Now let's begin our measuring process. We usually do this kind of procedure before our start of the treatment and then regularly. Okay, let's start. This is the basic microscope for measuring the hair density and hair thickness and response of the patient. I usually use 30-fold magnification and 60-fold magnification. In general, I start using the 30-fold magnification for the measuring the accurate density. Okay. We have to be very consistent in measuring the response of the patient, and this is the 60-fold magnification picture. Maybe you can see the hair thickness and the condition of the scalp. Now we take the picture in a static motion, and then we can measure the thickness. Now we can measure the exact diameter of the hair shaft. We can measure hair thickness about 200-fold magnification view, but when we measure the density, I usually recommend to do that in a 30-fold magnification view. And actually, for accurate measurement, we made a tattoo and we should cut the hair, but for general patients we cannot cut the hair, so usually we make a round circle. The diameter is 1 centimeter, so we can actually count the density. Before we start the main process, I usually recommend to wash our hair and scalp very thoroughly. We can use diverse devices, but this is the general shampooing process. And we use a very high pressure. We can make it adjustable. We can adjust the pressure of the water. And what is more important is the pulsation. The pulsation consists of 1800 pulses per minute, and it can enable the machine to cleanse the pores thoroughly. This is the steamer process, and this steamer vaporizes water, and the hot steam of water goes in here, and that gives us a little bit heat to the scalp, and that enables the pores to be open and ready for the acceptance of the AAPE. Functional erbium glass laser, and as you see, the laser beam goes out in a fractional mode, and let's start. And I radiate the heat to the scalp. Layer by layer. This is the device for the mesotherapy. So the mesotherapy, we can do the little bit less painful injection for the patient. I usually do not use AAPE for the mesotherapy. This is for other components like other vitamins or other nutrients. This is the AAPE box for hair treatment. And the AAPE consists of one powder and the other for the activator. Now AAPE is ready for use. And this is the micro needle that I use. The micro needle consists of 0.5 millimeter needles, multiple needles, about 200 needles, and it rotates. And this is one use only, single use only. And we generally apply the AAPE, and I use the micro needle for the making some micro holes in the scalp. What is important is that this patient does not feel any severe pain, and what I recommend is that the pressure don't need to be so severe to cause bleeding. Gentle maneuver is enough. We can use diverse devices. Maybe you can use micro needles, but we also can use autostem. This is the vibrating needles. It consists of about 9 needles or so, and it vibrates very fast, moves very fast, and we can adjust the length of the needle. Now the scalp becomes a little bit pinkish, but do not cause bleeding. It does not cause any severe pain. Becomes a little bit pinkish, but not bleeding. Maybe for some ladies, we have to focus more on the hairline area. After I apply the AAPE to the scalp, then I recommend to do the low-level laser treatment. The low-level laser acts as a biomodulation. Maybe this process usually takes about around 10 minutes.